I'd like to take a few moments and talk to you about thyroid function and dysfunction and how the thyroid works. A lot of people do have thyroid problems and they're not really understanding how the thyroid works and how that thyroid receives information through the brain and how it relates to different parts of the body. Most of the time when we get blood tests done, we look at what is called the TSH, the thyroid stimulating hormone, and it should have particular numbers to it to see whether it's functioning hypothyroid, normal, or hyperthyroid. Well, let me show you how all this works. Now I'm going to use the board here to be able to kind of draw it out. So if the thyroid is giving information to the brain, it gives it to what is called the hypothalamus. The hypothalamus of the brain right now is probably kind of like the general, and it sends out information, sends out orders down to the pituitary gland. How it does that, it has what is called thyroid releasing hormone down to the pituitary gland. And then the pituitary gland, it releases what is called the thyroid stimulating hormone. And this is what is being measured on your blood test that your doctor does to determine whether or not you have hypothyroidism or hyperthyroidism. And so then the TSH is released into the thyroid gland. Then the thyroid gland releases two hormones, T3 and T4. Now this is highly, highly important. The T4 is, quite a bit of that is being released, and it cannot be used until it's turned into T3. So the T4 goes over into the liver and into the gut. And that's where it's modulated into T3, so the body can start regulating the thyroid gland and what its functions throughout the body. Now the key to this whole thing is this. The T3 and the T4 are modulated into the liver and the gut. If you have some stomach problems or if you have some liver problems, this cannot be regulated properly, so therefore you're going to end up with some kind of thyroid problem. So if this thyroid problem continues to go on, well, your body's metabolism is going to be off, your body's heat mechanisms are going to be off, several other areas of the adrenals could be off, the pancreas could be off, other different glands of the body. So when we look at the whole body, as a chiropractor should be looking at the whole body, we need to know the processes, how the body is working. So therefore, if you have stomach problems or liver problems that need to be checked or taken care of, it all goes back to how the thyroid is working as well. Thank you very much.